morning, my name is Kaitlyn. I'm a student nurse. I'll be looking after you today. I just have to set up, the doctor's ordered you some morphine through a PCA to be given to you. So I'm going to go and set that all up for you, but I've just got to do a couple of things before I do that. I need to check your name and date of birth, if that's okay?
Yep.
Alright, can you please tell me your full name?
It's Miriam Adi.
Miriam Adib. Your date of birth, Miriam?
Yep, 7th of January 69.
7th of 1st, 1969. Just check your number here, 174. 963. Okay, are you allergic to anything?
No.
Alright, no problem. Now, before I go, can you tell me a little bit about your pain? On a scale of 0 to 10, how bad is your pain? 10 being the worst you've ever felt.
So I think it's around 8.
Around an 8 out of 10. Okay, and can you tell me where it is?
It's on my chest.
Your chest, and how long, how's the pain? How long has it been going on for?
I've been feeling it for like half an hour now.
Okay, no worries. Alright, now I'm just going to do a set of obs on you first so we can get a baseline data before we give you some medication. And I'm also just going to check your cannula. So there's no redness, no inflammation, so that looks pretty accessible to access. Okay, so thank you for that, Miriam. I'm going to go and set everything up now. I'll be back with you in a moment, okay? Alright, so do you mind validating this order with me? Okay, so the patient is Miriam Adir. Date of birth and MRN has been confirmed. She's got no known allergies. So the morphine is indication is for her fractured ribs. So the medication is morphine. So we need to have 50 milligrams in 50 mils. The doctor has signed and printed and left the date, contact number. So the concentration will be 1 milligram in 1 mil. Number of syringe will be 1. There'll be 1 PCA dose, a lockout interval of 5 minutes, no basal infusions, and the hourly dose limit is 12. It's been signed. Now, a couple of antiemetics have been charted as well. Metoclopramide 3 times a day if needed, so 10 milligrams by IV. Doctor has signed and dated. And also naloxone is 0.2 milligrams IV, interval is 2 to 3 minutes. It's also been signed and printed, and it also hasn't been given yet.
Yeah.
Okay, so it hasn't been set up yet. Okay, are you happy with that?
Yes.
Okay, now first, let's just quickly read the MIMS and we'll just see what this morphine's all about. Alright, so we've got morphine, it's opioid analgesic. The indication is moderate to severe pain. And the contraindications is opioid hypersensitivity, could be some for bronchial asthma, obstructive airway, respiratory depression as well. And could have some cyanosis, so a few things to look out for. So precautions in high doses are repeat administration. It interacts with other depressants including alcohol and other opioids or sedatives. And the dose here we've got is for adults is for PCA, demand dose of 0.5 to 1.5, and we've got a demand dose of 1 milligram. So that's all fine. Okay, I just got my calculations here as well if you want to check. So we need 50 milligrams of morphine. The stock required, the stock strength is 10 milligrams in 2 mils. So that's 10 mils of morphine. So we've got 10 mils times 2, so that's 50, so we have a total of 5 ampules for the morphine, and then we also need to make up the other 40 mils. We'll be using normal saline, so that's the 50 mils minus 10, it's 40.
Yeah.
Okay, happy with that?
Yes.
Okay, so that's all calculations. Alright, and I'm just going to go over and get our drugs now. Are you happy to come and check?
Yeah, sure.
Alright. So we'll take our chart. Got my pen. Okay, so here are the drug covered. We need morphine, 10 milligram, 50 milligrams and 50 mils. So we'll have a look. Open our cupboard up. Get our book. What's that? This one? Alright, so just quickly check. Morphine sulfate, 10 milligrams and 2 mils. Okay? Okay, so we'll count the stock that we have at the moment. Okay, so we've got 1, 2, 3, 4, 5. As you can see, the batch is morphine sulfate injections, 10 milligrams in 2 mils. Expiry is 10/20, so it's 5. We've also got another 5. 1, 2, 3, 4, 5. So now I have 10. Morphine sulfate 10 milligrams in 2 mils, expiry 10/20 for all those 5
Yep.
batch. And now we have another batch here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So we should have 20 altogether.
Yes.
This batch as well, morphine sulfate injection 10 milligrams in 2 mils, expiry 10/20.
Yep.
Okay, so we should have 20 left, and I've got 20 here. Are you happy with that?
Yes.
Okay, so we need 5 ampules. So I'm going to take 5, and that means we should have 15 left. So I'll check the 15 remaining. 1, 2, 3, 4, 5. This batch is all morphine sulfate, 10 milligrams, 2 mils, expiry 10/20. So that's 5.
Yep.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So I have 10 here. Morphine sulfate 10 milligrams in 2 mils, expiry 10/20.
Yep.
Okay, so that's 15. So 15 going back. Okay, and I'll count these ones and check again. 1, 2, 3, 4, 5. Morphine sulfate 10 milligrams, 2 mils, expiry 10/20.
Yep.
Okay, so we'll fill out this date today. It's always happening. 16th of the 5th, 17. Time is 15:30. Got the patient's details here. Miriam Adib. Let's not lose the morphine. Okay, so amount given is 50 milligrams. Okay, and we had 15 going back. It is in Hunt. Alright, so if you're happy with that, can you please sign? Okay, thank you. Okay, so I'm going to put this back, and then I'm going to go back to my equipment and do my first drug check.
Yep.
Okay, so I have my morphine, let's go. Okay, so do you mind being my checker? I'm going to do my first drug check.
Yep.
So the patient's name and identity has been confirmed. Patient's name is Mary India. She has no known allergies. So the drug we're doing is morphine. 50 milligrams of 50 mils. So I've got morphine here. Morphine sulfate injection, 10 milligrams in 2 mils, expiry 10/20. And we need 50 milligrams. So from my calculations, we'll need 5 ampules. So I've got 1, 2, 3, 4, 5. As you can see, they're all the same batch. Okay. Now to make up the remaining 40 mils, we'll use normal saline. So I've got sodium chloride 0.9% in 10 mil, and the expiry is December 18. So we've got 4. So 1, 2, 3, 4 to make up the remaining. Okay, and so the doctor has signed and printed, and it hasn't been given yet, so it's the right time to give the dose.
Yep.
Okay. From my calculations. going to do my second drug check. Okay, so Mirimadib, the patient identity has been confirmed. She's got no known allergies, so we're giving morphine, 50 milligrams and 50 mils. And with my medications, we've got 5 ampules. So 1, 2, 3, 4, 5. Okay.
Yeah.
We've got morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate, 10 milligrams, 2 mils, 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 expiry is 10/20. It's a batch of 5. So to make up the remaining 50 ml that we need, we'll be using normal saline. We've got sodium chloride, sodium chloride, sodium chloride, sodium chloride, 0.9, 0.9, 0.9, 0.9.
Yep.
Expiry is December 18, December 18, December 18, December 18. Okay?
Yeah.
Okay. Alright, so we've checked our drug. So we've got that it hasn't been given yet, so it's not up yet. The doctor has signed and printed, we've got our right patient, our right dose.
Yep.
Okay, so that's time to finish it all. Okay, now I'll put the rest of my... Case study. Do our third drug check. Okay, and I'll apply it afterwards. Okay, so third drug check, patient's name is Miriam Madib, her ID has been confirmed, she's got no known allergies. We're giving morphine 50 milligrams and 50 mils, so there we've got 50 milligrams. And as per my calculations, we've got 1, 2, 3, 4, and 5. Okay, so morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate, morphine sulfate. 10 milligrams and 2 mils for the batch, and expiry 10/20.
Yep.
Okay, so that's made our 10 mil. We need to fill the other 50 mil with normal saline, and we've got 40 mil of that. So we've got 4 sodium chloride. Sodium chloride, sodium chloride, sodium chloride, sodium chloride. Okay, 0.9 in 10 mil, 0.9 10 mil, 0.9 10 mil, 0.9 10 mil. Okay, expiry December 18, December 18, December 18, December 18. Okay, so are you happy that's 50?
Yes.
Okay, so I'll get you to sign the other label for the additive. Yep. Go a couple times. There we go. Thank you. Pop it straight on. just check your number, 174963. 174963. Do you have any allergies, Miriam?
No.
No. Okay, no problem. I'll get that all set up for you. I should have done this before. I'll just grab this, sorry. Okay, so we've got morphine, 1 milligram in 1 ml. Concentration here, we've got morphine is 1 milligram in 1 ml. Okay, so you have a lockout of 5 minutes. We've got a lockout of 5 minutes. Okay, max here is 16, that's wrong. So we have to change that to our lockout, hourly dose is 12 milligrams.
Yeah.
So let's go down here, 16 alter. Pop that to 12, 12 milligrams here, confirm, okay, so we've got morphine, 1 milligram in 1 ml, PCA dose of 1, lockout 5, there's no continuous here, loading, the max is 12, here, okay, doctor signed, okay, so I'll just connect, now I'm going to swab for 15 seconds. Make sure this is all clean. Got some new gloves. Okay. Alright, Miriam, the struggle to get on gloves. Alright, let's swab here. 15 seconds. 15. Alright, good one. Make sure it's all clean. Protocol. Okay, so now we've got our PCA set up. Let's just confirm everything.
Yep.
Morphine here, 1 milligram in 1 ml, 1 milligram in 1 ml, lockout of 5 minutes, lockout of 5 minutes, and we've got max of 12 milligrams, 12 milligrams. All right?
Yep.
Go next. Confirm protocol. So we've confirmed it. Okay. Confirming. Okay. And start. Okay. Now, I'll give this to you, Miriam. So your PCA is all set up and it's all going through now. So I'll tell you a little bit about how it works. Okay, so I'll leave that one for you. Okay, so the PCA is controlled analgesia. So if you have any pain, at any time you can press this green button and the morphine will come through. Okay, it does have a lockout, so as many times as you press it, you're not going to overdose on any medication because there is a lockout per hour. Okay, now if you want to press this one now, okay, the button lights up, okay, and a dose has come through. Okay, so I'll leave that one with you. And that's all ready for you to go. Okay, so if you need anything at all, you can buzz your buzzer, which is over here. Let me run around the other side. And I'll grab you your buzzer. If you need me or anything, you start feeling a little bit funny, you can press your buzzer as well and I can come back and see you. Okay, are you comfortable, Mariam?
Yes.
Okay, no problem. Now let me just go dispose of my equipment and I'll fill out the book and then... Okay. So grab this pen, date up. It's the 16th of the 5th, 17. Time up, it's 15:45. Okay, my initial, if you're happy, your initial.
Yep.
Okay. Okay, documentation's filled out. I'll throw out my equipment.